About 1 in 2 men will be diagnosed with cancer in their lifetime, according to the American Cancer Society. Yet men are 24% less likely than women to have visited a doctor within the past year. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. November is Men's Health Awareness Month, also known as Movember, which focuses on raising awareness for prostate cancer, testicular cancer, and other men's health issues. With me today is Dr. Ryan Miller, a urologist at Advanced Urologic Associates at St. Luke's East Hospital. Thank you so much for joining us.
Thanks for having me, Lindsay.
So first of all, Dr. Miller, prostate cancer is the second most common cancer in men. When should men start screenings for this cancer?
Really, it's dependent a bit on risk factors. So those men who, in particular, have a first-degree family relative with a history of prostate cancer should start earlier than those men who don't. So typically in the range of 40 to 50. For the general health populace at average risk, really then age 50 to 74. And thereafter, it's really kind of shared decision making as to whether or not you want to continue screening thereafter. So.
Okay, and what do those screenings consist of?
So typically an annual PSA, which is a blood test, and then a digital rectal examination to try to detect any abnormalities of the prostate on exam.
Okay. Now, are there any warning signs or symptoms for prostate cancer?
Oftentimes, prostate cancer doesn't have a lot of symptoms associated with it, especially early on, which again stresses the importance of regular screening with PSA and digital rectal exam. There can be instances of advanced cancer where patients might experience things such as bony pain, aches and pains that are kind of out of the ordinary for them. But again, usually prostate cancer doesn't have a lot of associated symptoms, which again is important for screening purposes.
Now, what set St. Luke's East Hospital and Advanced Urologic Associates apart in prostate treatment?
Well, Lindsay, we recently received a Prostate Cancer Center of Excellence designation, and it's something we're really proud of. We're the first hospital here in the Kansas City Metro that's received that designation. Basically, there are certain standards that we have to meet in terms of the prostate cancer care that we deliver, certain criteria that we are designated to have, which means essentially when you come to see us, you're going to get good care, for your prostate cancer.
Now, moving on to testicular cancer, what age group is most affected?
So it's interesting, testicular cancer typically affects a much younger age group than prostate cancer. The most common age range for testis cancer is anywhere from 15 to 35. You can certainly have patients that are younger than that or older than that develop testicular cancer, but the most common ages are from the teens to the mid-30s. And so that's, a little bit different than prostate.
Wow. Okay. So what are the screening recommendations for testicular cancer?
And so I think, the medical community has done a really good job of emphasizing cancer screening, particularly for women with breast cancer. And monthly screenings, for testicular cancer, we've adopted that same sort of idea where just once a month, essentially, the patient ought to examine themselves and make sure that they don't feel any abnormalities, on the surface of the testicle. And if they do, bring it to the attention of their primary care provider or even a urologist if they already have one. And then we can do further workup to determine if things need to be treated. Now,
aside from feeling an irregular lump or bump, are there any other warning signs for testicular cancer?
There can, on occasion, be an achiness, perhaps in one of the two testicles or just really anywhere in the scrotum. And if that persists or certainly, worsens over time, that would be, something to let your physician know about so that, a full exam and additional evaluation can be undertaken.
Now, talking about overall men's health, why are these regular checkups so important along with a healthy lifestyle?
I think, testicular cancer and prostate cancer are two highly treatable cancers, which in most cases can be curable, particularly if they're detected early. And so that it kind of stresses the importance of really performing regular, self-exams and having regular checkups, the PSA and the digital rectal exam, in particular with prostate cancer screening. Because again, if we can detect it early on, we've got a great chance of affecting cure.
Great. Now, what's your final message today?
Yeah, I think you mentioned earlier about men's reluctance to go to see their doctor, and I think a lot of that just has to do with maybe some embarrassment or anxiety regarding these very sensitive issues and sensitive areas of the body. And what I would remind people is, we're trained professionals. This is what we do. I have a great team of partners at Advanced Urologic Associates that are very knowledgeable, very compassionate, and I think you will see that there's a great level of comfort, coming to see us, because we're again doing this on a day in, day out basis. So.
Absolutely. Well, thank you so much for joining.
You're welcome.
To find out more about Advanced Urologic Associates or to schedule a consultation, visit stlukeskc.org/AUA. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.